Picture this. You wake up and your mouth feels so dry it almost startles you. Your tongue is stuck to the roof of your mouth. Your lips feel tight and cracked. And for a second, it feels like you have not had a drop of water all night. You try to swallow, but there is almost nothing there. Now, here is the part most people get wrong. In that exact moment, you probably tell yourself it is nothing, just another small annoyance that comes with getting older, something to ignore and move on from. But that dry mouth you wake up with every morning is not random, and it is not just about your mouth. In many cases, it is your body trying to point your attention to something else happening beneath the surface. Something most people never connect until much later when it becomes harder to ignore. My name is Dr. Michael Carter, and on this channel, I focus on helping adults over 60 understand what their bodies are really telling them in a way that is clear, practical, and based on real evidence. Because small everyday symptoms are often signals, and when you know how to read them, you can catch problems earlier and respond before they grow into something bigger. Today, we are going to take a closer look at one of the most overlooked signals, dry mouth in the morning. Not just what it feels like, but what it might actually mean. By the end of this video, you will understand the most common causes behind it, how to recognize which one might apply to you, and what simple steps you can start taking right away. And I will tell you this now, at least one of these causes is going to feel uncomfortably familiar. Before we get into the specific causes, there is one thing most people do not realize about saliva. It is not just moisture. Your body produces a significant amount of it every single day, and it plays a critical role in protecting your health. It helps coat your teeth, neutralize harmful acids, begin the digestion process, and even control bacteria in your mouth. In many ways, it is your body's first line of defense. So when you wake up and that system feels like it has completely shut down overnight, that is not something to ignore. It is a change. And changes like that usually have a reason. Let us start with one of the simplest and also one of the most overlooked causes. Mouth breathing during sleep. If your mouth stays open while you sleep even slightly, air is constantly moving across your oral tissues for hours. That airflow dries out saliva much faster than your body can replace it. By the time you wake up, your mouth can feel extremely dry, even if everything else in your health seems normal. The tricky part is that most people have no idea they are doing this. You are asleep, so you do not feel it happening. But there are a few signs you can look for. Do you wake up with your mouth open? Do you notice dryness mainly in the morning, but not as much during the day? Do you sometimes wake up with a slightly sore throat? These are small clues, but they matter. Now, let us move to a cause that is far more common and often completely unexpected. Your medications. There are hundreds of prescription and over-the-counter medications that can reduce saliva production as a side effect. Blood pressure medications, allergy pills, certain antidepressants, sleep aids, and even some common pain relievers can all contribute to dry mouth. But here is where it becomes more important. It is usually not just one medication causing the problem. It is the combination. I once worked with a patient named Harold Bennett, a 72-year-old retired maintenance technician who was very careful about his health. He had been dealing with severe dry mouth every morning for nearly 2 years. He tried different rinses, changed his habits, and even saw his dentist multiple times, but nothing seemed to help. When we reviewed everything he was taking, we found something interesting. He was using several medications and supplements at the same time, and at least 3 of them were known to reduce saliva production. Not dramatically on their own, but together the effect was much stronger. Instead of changing his prescriptions completely, we simply adjusted the timing of when he took a couple of them. Within a few weeks, his symptoms improved significantly. That is why this step is so important. Write down everything you take, including supplements and over-the-counter products, and bring that list to your pharmacist or doctor. A small adjustment can sometimes make a much bigger difference than you expect. Now, let us move into a cause that sounds simple on the surface, but is much more deceptive than most people realize. Chronic dehydration. Most people assume they would know if they were dehydrated. They expect to feel thirsty. But as we age, that signal becomes much less reliable. Your body can be low on fluids, sometimes significantly low, without sending a strong feeling of thirst at all. That means you can go through most of your day slightly dehydrated without even realizing it. And overnight, when you are not drinking anything for several hours, that small deficit becomes much more noticeable. One of the first places it shows up is in your mouth. You wake up with that dry, sticky feeling, and it seems to come out of nowhere. There are a few reasons this happens more often as we get older. Your body becomes less efficient at conserving water. Certain medications can increase fluid loss, and if you drink coffee or alcohol later in the day, that can make the effect even stronger. The key here is not to wait until you feel thirsty. Instead, think of hydration as something you schedule just like taking your medication. Spreading your water intake throughout the day, even in small amounts, can make a noticeable difference in how you feel the next morning. Now, there is another cause that can also lead to persistent dry mouth, and this one is important because many people have it without knowing. Blood sugar imbalance. When your blood sugar levels stay elevated for long periods of time, your body tries to remove that excess sugar through your kidneys. To do that, it pulls more fluid from your tissues and increases urine production. Over time, this creates a kind of ongoing dehydration inside your body. And again, one of the first places you may notice it is in your mouth. But dry mouth is usually not the only signal. There are often other subtle signs that show up alongside it. You might find yourself waking up more often at night to use the bathroom. You may feel more tired than usual even after a full night of sleep. You might notice that small cuts take longer to heal, or that your vision occasionally feels slightly blurred. Individually, these symptoms can seem minor, but together they can point to something that should not be ignored. If any of this sounds familiar, it is worth having a simple conversation with your doctor. A basic blood test can give you a clear picture of what is happening with your blood sugar, and catching it early can make a significant difference in how it is managed moving forward. Now we are going to move into a cause that is often overlooked at first, but can have a much bigger impact on your health than just dry mouth. Sleep apnea. This is a condition where your breathing becomes partially or completely blocked while you are asleep. When that happens, your body has to compensate. One of the ways it does that is by switching to mouth breathing, sometimes repeatedly throughout the night. And as you already know, hours of mouth breathing can dry out your saliva very quickly. But here is why this matters more than it seems. Sleep apnea does not just affect your mouth, it affects your entire body. Poor oxygen flow during sleep can put stress on your heart, disrupt your sleep cycles, and leave you feeling exhausted even after what should have been a full night of rest. The difficult part is that many people do not realize they have it. You are asleep when it happens, so you are not aware of the interruptions. However, there are some patterns you can watch for. Do you snore loudly? Has anyone ever told you that your breathing sounds irregular during sleep? Do you wake up feeling tired even after several hours in bed? Do you find yourself feeling sleepy during the day in situations where you normally would not? If you notice a combination of these signs along with dry mouth in the morning, it is worth looking into further. A simple sleep study, many of which can now be done at home, can give you clear answers. Now, let us look at another cause that is less obvious but still important. Natural decline in salivary gland function. As your body ages, many systems gradually slow down, and your salivary glands are no exception. They may not produce the same amount of saliva as they once did, especially during the night when production naturally decreases. This can lead to a baseline level of dryness that becomes more noticeable over time. The key difference here is that this type of dryness tends to develop gradually. It may not feel sudden or severe at first, but over months or years, you begin to notice that your mouth feels drier more often, especially in the morning. While you cannot completely stop this natural process, there are ways to manage it. Staying consistently hydrated during the day helps support saliva production. Chewing sugar-free gum, or using products that stimulate saliva can also be helpful. And maintaining good oral hygiene becomes even more important because less saliva means less natural protection for your teeth and gums. Understanding this cause helps you separate what is part of normal aging from what might require closer attention. Now, let us talk about a cause that is less common than the others but very often overlooked and in many cases significantly delayed in diagnosis: an autoimmune condition. There is a specific condition in this category that is closely linked to persistent dry mouth, especially in adults over the age of 60. It is a disorder where the body's own immune system mistakenly targets the glands responsible for producing moisture, including your salivary glands. When that happens, your body gradually loses its ability to produce enough saliva. Unlike some of the other causes we have discussed, this type of dry mouth is usually not occasional. It tends to be persistent. Day after day, the dryness does not fully go away, and over time, it may even become more noticeable. But what makes this condition particularly important is that dry mouth is rarely the only symptom. Many people also experience dry, irritated eyes, a gritty or burning sensation, ongoing fatigue that does not seem to match their level of activity, or joint discomfort without a clear cause. These symptoms can appear gradually, and because each one seems manageable on its own, they are often dismissed or treated separately. That is one of the main reasons this condition can go undiagnosed for years. It is especially important to pay attention if you are a woman over the age of 55, as this group is affected more frequently than others. But regardless of age or gender, if you are noticing a pattern of persistent dryness, along with other unexplained symptoms, it is worth bringing up directly with your doctor. A simple conversation can lead to the right tests, and getting clarity early can make a meaningful difference in how the condition is managed. The key takeaway here is not to assume that ongoing dryness is something you simply have to live with. When your body consistently produces the same signal, especially when it is paired with other changes, it is worth taking a closer look. Because sometimes what seems like a small localized symptom is actually part of a much larger picture. Now let us bring everything together. Waking up with a dry mouth in the morning is something many people experience, especially as they get older. But as you have seen today, common does not mean normal, and it certainly does not mean something you should ignore. In many cases, that dryness is not the problem itself. It is a signal that your body is trying to draw your attention to something happening beneath the surface. Sometimes it is something simple, like the way you are breathing at night or how you are hydrating during the day. Other times it can be connected to medications, blood sugar, sleep quality, or even conditions that take time to recognize. From my experience, what matters most is not jumping to conclusions, but also not dismissing repeated signals. The people who tend to do best long term are not the ones who panic over every symptom, but the ones who stay curious and take small, consistent steps to understand what their body is telling them. So here is a simple place to start. Take a few minutes to review your medications. Pay attention to your sleep patterns. If something feels off, ask questions. If you have not checked your blood sugar recently, consider doing that. And begin treating hydration as part of your daily routine, not something you rely on feeling. These are small steps, but they can lead to meaningful clarity. Now, I do want to be clear about one thing. This video is meant to help you understand possible patterns and connections, but it is not a substitute for medical advice or diagnosis. Every individual is different, and if you are experiencing persistent symptoms or anything that concerns you, it is always best to speak directly with a qualified healthcare professional who can evaluate your specific situation. The goal here is awareness, not self-diagnosis. Because once you start paying attention to these signals early, you give yourself the opportunity to act sooner, ask better questions, and make more informed decisions about your health. Now, I would like to hear from you. Which of these causes felt the most familiar? Was it your sleep, your medications, or something else? Let me know in the comments below. I read every one of them, and it genuinely helps guide what we talk about next. And if this gave you a clearer perspective than what you have heard before, consider subscribing. There is a lot more to uncover, and in the next video, we are going to look at a surprisingly common health habit that may be doing more harm than good for adults over 60. Take care of yourself, and I will see you in the next video.